Conventional medical practitioners tend to think that parasites are rare. Alternative medical practitioners tend to think they're common. The truth is actually somewhere in the middle. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, I want to tell you about a patient I saw several years ago. Her journey to get to the right answer about what was going on in her GI tract left such an impression on me that I actually wrote about her in my first book, Gut Bliss. From the very beginning, Lucy was convinced about what was going on. She walked into her first appointment with me and said, "I have a parasite and you have to find it and fix it." Lucy had seen a bunch of different gastroenterologists before me, and reading between the lines of their notes in her medical records, I could tell they thought she was a little bit intense. And Lucy was a little bit intense, and I actually would have been too if I had had symptoms for that long that no one could explain and that weren't getting any better. Lucy was super bloated, she had upper abdominal pain, she had nausea, and she had what she described as weird stools, and she also complained about feeling tired all the time. The first gastroenterologist Lucy saw did an upper endoscopy looking for signs of acid reflux. It's sort of gastroenterology 101, right? All roads lead to acid reflux for a lot of gastroenterologists. But her upper endoscopy was totally normal. They still went ahead and put her on acid blockers for a month. No response. In fact, I think she felt a little worse on the proton pump inhibitor, the acid blocker, from what she told me. Next step, stool studies for ova and parasites. We look for ova, the eggs of the parasite, because sometimes we aren't able to detect the adult parasite, but we can find earlier stages, the egg stage. The first gastroenterologist that Lucy saw ordered a stool test for O&P, ova and parasites, and that came back negative. But when I asked Lucy how many jars of stool she had sent off for that test, she told me just one. And this is a really important point because the probability of finding a parasite increases dramatically from about 60% when you send a single specimen of stool to more than 95% when 3 specimens are examined. So I asked Lucy to use a popsicle stick and scrape her stool into 3 different jars and send it off to a specialty lab in Arizona that I use that has a really good track record for diagnosing parasites. Now, when it comes to labs that test for parasites, we have to apply the Goldilocks principle. A lot of commercial labs just do not spend the time and the effort. It takes a lot of effort. Sometimes you have to use different growth medium, you have to use different techniques, and they just don't spend the time to do that. And as a result, they have pretty low sensitivity. They miss a lot of things, particularly the less common parasites. But at the opposite end of the spectrum, you have this sort of direct-to-consumer labs that are all over the internet, and they tend to overdiagnose. And the problem there is that they are often reporting normal organisms in the stool as pathogens. So really, what we're looking for is a lab that is sensitive enough to detect even low levels of problematic organisms. And again, it's looking not just for the parasite, but for the egg. But a lab that is not so overly sensitive that they're misdiagnosing normal gut organisms as parasites. And coming up next, what did the specialty parasite lab find in Lucy's stool? The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation, backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. My super reliable parasite testing lab found nothing in Lucy's stool. No eggs, no worms, nothing. Since her stool didn't show anything, I decided it was time to take a look inside Lucy's digestive tract. So I did a colonoscopy. She'd already had an upper endoscopy with the other gastroenterologist, so I decided to look the other end. I took multiple biopsies in every segment of her colon because although it looked normal, I wanted to check for microscopic evidence of inflammation. When those biopsies all came back normal, it was time to extend the investigation to her small intestine. It can be hard to reach all 20 feet of small intestine. That's a part of your digestive tract that's sandwiched between your stomach and your colon. And it's too long to completely examine with a traditional endoscope. But there are some sort of novel, cool ways to get a look at it. And one way is something called a video capsule endoscopy. And that's a tiny capsule that has a camera, a light source, a transmitter, a semiconductor, and a battery, all packed into a pill about the size of a large vitamin. You swallow it, and then it's just flushed when you excrete it out the other end. And it transmits thousands of images, about 2 per second, that are compressed into this incredible, fantastic voyage video. And I love watching these videos of the small intestine. They're absolutely stunning to look at, and they can give you really important information. But Lucy's video of her small intestine showed image after image of basically normal small intestine. There was not very much to look at. So she had now had her entire digestive tract examined from her mouth to her anus. She had the upper tract, which is the mouth, the esophagus, the stomach, the duodenum, the first part of the small intestine. And then with the video capsule endoscopy, she had the duodenum looked at again, the jejunum, the middle part of the small intestine, and the ileum. And then with the colonoscopy, I looked at her whole colon, and I even went up into the ileum. So some parts had been examined more than once, but all of it looked completely normal. So then I started to think, maybe the problem is inside her abdomen, but outside her intestines. So I ordered a CAT scan of her abdomen, which showed normal abdominal organs, nothing unusual whatsoever. So then I thought, okay, her organs look normal, but maybe they're not functioning normally. So I ordered a scan to check out her gallbladder function, a scan called a HIDA scan. And a malfunctioning gallbladder can definitely cause a lot of the symptoms Lucy was having: bloating, nausea, upper abdominal pain, weird stools. But when her HIDA scan for her gallbladder function came back normal, I ordered a gastric emptying study, a test where they give you radio-labeled food to eat. They give you liver, oatmeal, eggs, depending on where you get it done. And then they scan over your stomach to see how long it takes for the food to empty. If a significant percentage of the food is still in your stomach at the end of the test, that's considered diagnostic for delayed emptying. And that's a condition called gastroparesis, and we will definitely be doing an episode on that. And gastroparesis can also cause bloating, abdominal pain, nausea. But her gastric emptying study was also normal. Next step, I asked Lucy to make a bunch of dietary changes. She went gluten-free. She eliminated dairy. She did no refined sugar. She cut out fructose. She did all kinds of things. No change whatsoever. Although, in fairness, some of the dietary changes she felt sort of generally a little better overall, but nothing that really was getting rid of the symptoms. During one of her follow-up appointments to go over all these different test results, Lucy pulled out some photographs of her stool on her phone. And I actually have a folder on my computer and a whole album on my phone called Poo Pics. And this is all images of stool. My stool, especially some of the big luscious ones, my daughter's when she was little, and I could still get in there and snap a pic. She has long since rescinded permission for that. Pictures of my patient's stool that they send me and give me permission to have on my album. And sometimes just random strangers who send me pictures of their stool. What can I tell you? My love language is, what your stool looks like. And I can tell you, it is amazing, all the different permutations of what stool can look like and how much you can learn from looking at someone's stool. It is literally like reading tea leaves. So what did Lucy's stool look like? In the pictures, there was an oily sheen to Lucy's stool, and she mentioned that sometimes Some of her bowel movements floated. Now, she didn't have any reason for her pancreas not to be working properly. She wasn't a drinker. She didn't have gallstones. She wasn't on any medications that can affect the pancreas. But her stool and her symptoms fit the bill. She had oily-looking, foul-smelling stools that floated, crampy abdominal pain, bloating, low-grade nausea. These are all symptoms consistent with a diagnosis of pancreatic insufficiency. But it's important to note that these are not symptoms that are specific for pancreatic insufficiency. These are symptoms, as you've heard, that can fit a lot of different things, right? It could be the gallbladder, it could be the pancreas, it could be the upper tract, etc. But because we had not gotten anywhere with the rest of the evaluation, I thought, okay, maybe her pancreas isn't working as well as it should. So I gave Lucy a prescription for some pancreatic replacement enzymes, and I was feeling optimistic that maybe we had finally cracked the case. Lucy took the pancreatic replacement enzymes religiously with each meal. I'd given her a pretty good dose, so she was taking 3 or 4 capsules with each meal. And after 6 weeks, there was no difference whatsoever. At a total loss for what to do next, I asked Lucy to send one final set of stool specimens to the lab of a local infectious disease specialist here in Washington who has a lot of expertise in parasitology. And I'm sad to say that this was several years ago with Lucy. This practitioner has since retired, and it's a real loss for the community because with all the people we have in Washington who work for the State Department and the Peace Corps and different international organizations, he was a real resource, but he's no longer in practice. So she sends off the stools, and he actually called me about a week later. And he called to tell me that her stool was positive for cyclospora, a tiny one-celled parasitic organism that spread through exposure to contaminated food or water. And it's best known for the 1996 outbreak associated with stool-tainted raspberries that made around 1,500 people really sick. Cyclospora usually causes diarrhea that can persist for several weeks. And then additional symptoms it can cause include bloating, low-grade fever, abdominal cramping, poor appetite, weight loss, increased flatulence, vomiting, and fat malabsorption that results in oily floating stools. And relapses with cyclospora are common if you don't treat it. Lucy finally got an answer, not because of my amazing diagnostic skills. It took me a long time to get to the answer. But she got an answer because we both believed that something was wrong, and we were willing to roll up our sleeves and find it. She was willing, as a patient, to jump through all these hoops I asked her to jump through, and I was willing, as her doctor, to believe her and to keep looking. Parasites can live in the body undetected for years. And in addition to causing sort of nonspecific symptoms like bloating, they can create problems like diarrhea, rectal itching. Certain parasites can cause blood in the stool. Others can cause mucus in the stool. Low-grade fevers, body aches, anemia, fat malabsorption, joint pain, teeth grinding, gallbladder dysfunction, even neurological symptoms with some types of parasites. So you can see here's part of the problem. The symptoms are really far-reaching and they're very nonspecific. A lot of these symptoms you can see with lots of other conditions. So it can be really hard to make the diagnosis. Parasites are a lot more common than most people realize. They affect a huge number of people worldwide, and according to the CDC, up to about a third of the population in the United States. But here is what you need to keep in mind. Many, if not most, parasites are harmless and they don't cause any symptoms whatsoever. So here's a piece of advice for you. If you think you have a parasite, you need to make sure your specimens are being sent to a reputable lab that has a good track record for parasite diagnosis. If you're using one of those labs where everybody's positive, that's a problem. If you're using a lab that's not diagnosing anyone, that's probably also a problem. And if the first test doesn't show anything and you're still convinced, get a second opinion somewhere else like we did with Lucy. But again, really important, be wary of those labs that are misdiagnosing everyone with a parasite and are also quick to sell you the cure. So what types of parasites infect the human digestive tract that you should know about? Really 3 kinds: tapeworms, roundworms, which are also known as nematodes, and protozoa, which are tiny one-cell organisms. And these parasites can range in size from microscopic, when we talk about protozoa, to several feet long when we talk about tapeworms. And they can stay in the intestines, or some of them can invade other distant organs. And again, some of these are harmless species that don't lead to any problems, and others can cause acute and chronic and serious symptoms. The 5 most common intestinal parasites in the United States are Enterobius vermicularis, known as pinworm, Giardia lamblia, usually just called Giardia, and Ancylostoma duodenale. That's a kind of hookworm. That's old world hookworm. Necator americanus. That's another kind of hookworm. That's New World hookworm. And Entamoeba histolytica, otherwise known as amoebiasis. These names are so fantastic. When I was in medical school, I loved parasitology. We had a wonderful professor named Dixon de Pommier, and I was actually quite convinced that I was going to name my daughter Ancylostoma duodenale, old world hookworm. But my husband had other ideas, so we called her Sydney. So these are the 5 most common intestinal parasites in the US. And the most common intestinal parasites worldwide are Ascaris lumbricoides, hookworm, Trichuria trichuria, whipworm, which is also pretty common in the US, Giardia intestinalis, not Giardia lamblia, which we see mostly in the US, and Strongyloides stercoralis, threadworm. So, how do you get rid of these unwanted guests? Coming up next. The good news is that many parasitic infections are asymptomatic, or the symptoms are very short-lived and they resolve on their own without any treatment at all. So that's the good news. The bad news is that parasites like Giardia and several others can leave you with long-term symptoms because they can be really difficult to eradicate. And sometimes the symptoms can continue even after the parasite is dead and out of your body. Symptoms like bloating, low-grade nausea, burping, and fatigue can occasionally become chronic after somebody has had something like Giardia. Many of the patients I see in my office with chronic bloating recall having diarrhea on spring break in Mexico or dysentery while they're on safari in Southern Africa. And now, months later, although the worst of their symptoms are over, they still don't feel quite right. Figuring out which parasites are actually causing the symptoms and how to treat them can be a really gray area. In the medical literature, for example, Blastocystis hominis is often described as a harmless pathogen that does not need to be treated. But alternative medicine practitioners frequently recommend therapy. And to make things even more confusing, some studies suggest that finding blastocystis in the stool is actually a marker for increased bacterial diversity and is a sign of a healthy microbiome. So what do, right? Do you treat, not treat? What do you do? So I want to give you 10 gutless solutions for approaching this issue of parasites, preventing them, etc. If you are exposed to a parasite, the likelihood of whether it's going to set up shop in your digestive tract and cause symptoms is, just like all other types of infection, bacterial, viral, fungal, it's related in large part to how healthy your immune system is. So here's some stuff you need to know with that in mind. My top 10 gutless solutions for parasites. Number 1, and you knew this was coming, it's diet. A healthy, high-fiber diet, plenty of rest and exercise, limiting your exposure to chemicals and other toxins, that is all foundational for creating a healthy immune system, and that can help prevent parasites from becoming a chronic problem, even if you are exposed. Number 2, just like most forms of pathogenic bacteria, parasites have a sweet tooth, so limiting starchy, sugary foods is also really important. Number 3, maintaining healthy levels of good bacteria in your gut by avoiding unnecessary antibiotics is essential, because that way you have a good bacterial army to discourage growth of parasites if you are exposed. Number 4, A daily tablespoon of ground psyllium husk powder is like a broom that sweeps debris out of your intestines, and it can help to remove parasite eggs that may be attempting to make a home. And I'm frequently recommending ground psyllium husk if people are constipated, if people have diverticulosis, sometimes even for diarrhea. It can help bulk the stool. So not a bad idea to try that. Number 5. Eating foods rich in vitamin A precursors like carrots and sweet potatoes can help to prevent parasitic larvae from penetrating, and raw garlic also has antiparasitic qualities, and these are things that are also super good for your gut and your microbiome. Number 6. Parasites can be transmitted from dogs and other pets, so make sure that yours are regularly checked for worms and that you are disposing of their feces properly. You also need to be on the lookout for whether your pet is eating the infected stool of other animals. Now, pets, particularly dogs, frequently will eat the stool of other dogs, and puppies especially will eat the stool of grown dogs. And we think part of that is they're trying to sort of populate their microbiome. But if they're eating the stool of another dog, like out on a walk, and that dog happened to have Giardia, they can and likely will get Giardia. So again, this is something that puppies commonly do. You have to look out for it. And again, this one is kind of obvious, but don't walk barefoot where animals have been pooing. You know, I'm all about the rewilding and exposure to soil and nature and get out there and roll in the grass, but don't roll in the grass where there is dog poo. Number 7, make sure that you are not watering your vegetables with a contaminated water supply from any sort of septic tank or anything. This is not such an issue in cities, but in more rural areas, sometimes when folks have systems to reuse the water, if, again, that water is contaminated, you can contaminate the vegetables. Number 8, strict hand washing, careful washing of fruits and vegetables. If you are concerned about where they're coming from, if you have a sort of reliable source for the fruits and vegetables from a farmer's market or you're growing them or something, you're not too worried. This is not as essential. But if you're not sure, you have to be careful and make sure you're rinsing. And this one is very important. Avoid raw and undercooked meat. That is really essential. Number 9, as much as I love them, salad bars can be a little bit tricky. They can be an opportunity for food contamination. And one University of California study observed a salad bar sort of covertly and found that over half the people who were using the salad bar were in serious violation of the rules. They were using their fingers to sample the food, and they were committing other hygiene transgressions. And number 10, poor sanitation in community spaces, especially places like nursing homes and daycare centers, can contribute to the spread of parasites. So you have to think about that if you have members in your household who are using those spaces. So I want to leave you with 3 takeaways about this issue of uninvited parasitic guests in the digestive tract. Number 1, if you think you have a parasite, it is always better to get diagnosed and figure out if you really do, and if so, which specific one. The treatments vary dramatically, from single-dose over-the-counter cures to weeks of prescription medication. And there are also lots of natural remedies, including things that may already be in your kitchen, like garlic, black walnuts, papaya seeds, cloves. But there are also some natural remedies you have to be careful with, like wormwood tea, which is effective against many parasites and can be brewed up at home, but also has some potentially worrisome side effects, like sleep disturbances and even organ damage. Number 2, in the absence of a diagnosis, beware of signing up for internet cures that may or may not work and could have unpleasant side effects. You may ultimately need to see an infectious disease specialist or someone with expertise in parasitology. And be sure to ask when you make the appointment if they are familiar with diagnosing and treating parasites. And number 3, parasites are common. And although they're more common in certain parts of the world, you do not need to travel to sub-Saharan Africa to pick up a parasite. A parasite is also not usually the reason someone is having GI symptoms, but it may be. And so if you think that in your case it is the reason that you're having GI symptoms, it's a good idea to investigate it. They are more common than many people realize, and they can cause a lot of different symptoms. A healthy immune system starts with a high-fiber, low-sugar diet is still one of your best defenses for preventing and eliminating these uninvited guests. So that's it for this episode of the Gut Bliss Podcast on parasites. Coming up next week on the Gut Bliss Podcast, I'm going to be answering some questions from our listeners. If you would like to submit a question for me to answer on the podcast, use the contact page on gutbliss.com, or you can follow me on Instagram at gutbliss, and you can message me or put something in the comments. If you use the contact page on our website, gutbliss.com, you can send a written question, you can send an audio file, or even a video. I would love to hear from you. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.